Welcome back. In our last session, we covered LO2, where we looked at how to communicate health, safety, and welfare information across the site. Today, we continue with the Construction Site Supervisor Diploma module on supervising health, safety, and welfare and move on to LO3, being able to supervise health, safety, and welfare on site. We'll cover 5 key areas: ensuring operatives are competent, monitoring tools and equipment, maintaining accurate safety records, using safety data to spot trends, and applying supervisory duties under the Health and Safety at Work Act. Let's begin. Supervising health, safety, and welfare on site is both a legal responsibility under the Health and Safety at Work, etc. Act 1974, and a practical skill that safeguards people and projects across UK workplaces. The aim is to be able to supervise health, safety, and welfare by ensuring operatives are competent and capable for assigned tasks through appropriate training, CSCS/CITB accreditation, and fit-for-purpose task allocation, routine monitoring, pre-use checks, and maintenance of tools, plant and equipment, guided by PUA and LOLA where applicable, keep systems reliable. Accurate, secure records, from training logs to RIDDOR reports, support accountability and data protection obligations. Analyzing safety data and near-miss reports reveals trends and informs proportionate improvements to procedures and welfare provisions. Applied confidently, supervisory duties meet legal requirements, satisfy HSE expectations, and sustain safer, more productive sites for workers, contractors, and the wider public. As presented on this slide, the chart-style infographic titled Benefits of a Construction Site Coordinator summarizes why competent supervision matters. The central coordinator with a clipboard links directly to the preceding topic, ensuring operatives are competent and capable for assigned tasks. The 5 surrounding icons, warning triangle, magnifying glass, stacked coins, team group, and legal paragraph, map to the labels on the slide. These labels highlight supervision of specific safety risks, early detection and avoidance of problems, cost savings and fewer delays, oversight of multiple teams and companies, and fulfillment of regulations. This graphic anticipates the coming sections on monitoring tools, record keeping, and using safety data. HSE and CITB guidance, the TÜV Rheinland mark, reinforce UK practice. This slide talks about confirming valid certifications and training records. Inspect certificates and training logs on site. Cross-check CSCS, NVQ or CITB records, and verify renewal dates and endorsements. Sally Moyse and Mark Schenker, respected occupational health researchers, found that migrant workers face access and language barriers, so translated records and verified competence checks are essential. Record checks should be documented in a secure register. Clear verification supports supervision and leads into assessing experience and suitability for specific activities. This slide covers evaluating past tasks and matching operatives to activity risk levels. Review previous project records and references, and conduct observed competence assessments on site, a major global burden of disease study led by Farouzan Farr and colleagues offers methods to prioritize risks, so use local incident trends to guide how much experience a task needs, record findings in the training log, note endorsements, and ensure those with less experience are supervised closely, which leads naturally into supervising new workers and apprentices. This slide is about close supervision for new workers and apprentices. Pair an apprentice with an experienced operative, use a buddy system, hold daily briefings, and give task feedback. Sally Moyse and Mark Schenker, respected occupational health researchers, highlight supervised induction and translated materials for migrant workers to reduce unequal risk, stage independence with clear milestones and signed competency checks. Keep supervision records secure so coaching can be targeted, and prepare to provide additional coaching or task-specific instruction as required. This slide covers task-specific coaching and demonstration. Give a toolbox talk, then demonstrate the procedure and supervise practical application. Scott Lundberg and Sue-In Lee, researchers on model interpretability, note that explainable diagnostics increase operator confidence, so link demonstrations to explainable checks on plant and tools. Provide hands-on coaching until competence is shown and record sign-offs in the training log. Use frequent feedback and measurable checkpoints to close gaps, preparing the workforce for formal training where needed. This slide focuses on closing skills gaps with planned training. Identify gaps from observed assessments and training logs, then develop tailored plans, refresher courses, and mentoring Kathleen Lewis and colleagues, who work on an international database for risk assessment, stress centralized, standardized records to track training outcomes. A major global burden of disease study led by Firuzan Farr and colleagues supports using trend analysis to prioritize training. Enroll operatives on accredited IOSH or CITB courses and arrange off-site certification and assessments before shifting to tool and plant maintenance checks. This slide covers confirming pre-use checks are carried out properly. Verify documented pre-use checks and ensure operatives complete checklists correctly. As the slide shows, review signed pre-use checklists and observe checks during handover, noting any gaps. Sally Moyse and Mark Schenker are public health researchers who highlight migrant worker risks. According to their work on migrant worker safety, translated checklists and supervised handovers reduce unequal risk. Record findings securely per the Health and Safety at Work Act and prepare to confirm equipment suitability next. This slide explains ensuring equipment is fit for purpose and safe to operate. Confirm suitability against the task risk assessment and check guards, markings and safety features. As the slide examples state, verify load limits and manuals and test emergency stops before use. Scott Lundberg and Sue-In Lee are researchers on model interpretability in degradation diagnosis. According to their work, simple, explainable condition checks increase operator confidence and help supervisors validate maintenance decisions. Keep records of these checks to feed planned maintenance schedules. This slide sets out scheduling and tracking maintenance requirements. Establish planned maintenance schedules and priorities. Use logbooks, software, and reminders. As the slide examples show, set calendar alerts for service dates and record parts replaced and costs in a maintenance log. Kathleen Lewis and colleagues developed an international risk database. Lewis is an expert in standardized records, and their work supports centralized systems to aid audits. Link these logs to condition checks so supervisors can prioritize repairs and remove unsafe plant promptly. This slide covers removing faulty or damaged equipment from service. Isolate and tag defective items immediately and prevent use until repair or safe disposal. As the slide examples indicate, apply danger tags and barriers, log removal, and notify a supervisor at once. Scott Lundberg and Sue-In Lee's work on interpretable diagnostics supports early escalation when condition monitoring shows failure risk. Keep clear logs to show compliance with the Health and Safety at Work Act and to support prompt inspection reporting that follows. This slide asks to record inspections and report concerns promptly. Document inspections to support supervision and escalate hazards through formal reporting channels. As the slide examples show, submit incident forms and photos and maintain an inspection register for audits. Mohammed Firuzanfar leads global burden of disease studies, and his team use trend analysis to prioritize occupational risks. According to Firuzanfar, combining local reports with trend signals helps avoid misprioritization. These secure records support legal duties under the Health and Safety at Work Act and feed records and data analysis. Maintain inspection logs complete and timely. Record permits and daily sign-ins. Check dated entries and signatures, and cross-reference permits with inspection entries. Use simple checklists and sign-off fields so audits read clearly. Kathleen Lewis is an expert in standardized risk databases. According to Lewis et al. In their work on international databases, centralized consistent records improve auditability and cross-site comparisons. This links from recent equipment maintenance records and prepares you to protect documentation from loss and unauthorized access. Store records securely with access controls. Use encrypted backups and physical safes. Keep an off-site encrypted cloud backup copy. Lock cabinets and log access events. Start by verifying who may view or change records and implement role-based passwords and key logs. Scott Lundberg is a researcher on model interpretability. According to Lundberg and Lee, explainable diagnostics help supervisors trust electronic records and condition data. This follows the inspection log slide and prepares records for legal and organizational standards. Align records with regulatory requirements and company policies. Follow retention and format rules. Use approved templates and headers, and cite legislation and company procedures on every record. Provide clear retention dates and authorship. Kathleen Lewis is an expert in international risk databases. According to Lewis et al., standardized templates increase consistency and audit readiness. Also bear in mind that global burden of disease methods help prioritize data review, so keep records structured to support later trend analysis and audits under the Health and Safety at Work Act. Preserve originals and make authenticated copies for audits and investigations. Index evidence for quick retrieval and record chain of custody details when you retain CCTV, photos and forms. Keep originals in a locked store and use tamper evidence seals for physical items. Mohammed Faruzanfar leads global burden of disease studies. According to Faruzanfar and colleagues, trend analysis depends on reliable, retrievable evidence, so retain clear records. This follows legal format rules and sets up prompt updates if conditions or personnel change. Amend records promptly after condition changes and record personnel changes and role assignments. Log shift changes and handovers, update permits and responsibility sheets, and ensure new sign-ins carry dates and signatures. Sally Moyse is a public health researcher focused on migrant worker safety. According to Moyse and Schenker, verified competence checks and translated records reduce unequal risk, so record language needs and inductions. These updates link back to inspections and feed forward into safety data analysis and legal duty demonstrations. This slide asks to review accident and incident reports to spot recurring issues. Start by identifying patterns across reports and prioritize recurrent causes for supervisory action. Use the slide examples, such as repeat falls from height and machinery entanglement, to focus resources. Mohammed Faruzanfar leads large-scale burden of disease studies. According to Faruzanfar and colleagues, trend analysis helps prioritize risks, but local judgment matters. Keep records secure under the Health and Safety at Work Act and feed findings into near-miss monitoring next. Collect and analyze near-miss records to forecast emerging hazards, as the slide shows. Use trends to predict risks and to prioritize controls before harm occurs. Note the slide examples: clustering of slips near ramps and repeated equipment failures before incidents. Jeffrey Stanaway leads comparative risk assessments. According to Stanaway and colleagues, large-scale methods can guide prioritization, but must be triangulated with local data link, near-miss signals to behavioral observations and maintenance records so supervisors can act early. Record unsafe acts and safe behaviors during inspections and link them to tasks and the environment as the slide directs. Note the slide examples: missed PPE during toolbox talks and fatigued crews on late shifts. Sally Moyse is a public health researcher focused on migrant worker safety. According to Moyse and Schenker, verified competence checks and translated materials reduce unequal risk. Use these observations to shape training and procedures and pass clear evidence to those suggesting engineering or administrative improvements next. Recommend controls following the hierarchy of risk, as the slide lists. Propose engineering measures first, then administrative controls and PPE. Use the slide examples, such as installing guards and safety barriers, and updating procedures and retraining staff. Scott Lundberg is a researcher on interpretable condition diagnostics. According to Lundberg and Lee, explainable monitoring increases operator trust and helps supervisors justify engineering fixes. Record chosen controls and owners to meet duties under the Health and Safety at Work Act and prepare concise reports for teams. Summarize trends in concise reports and present data-driven recommendations with clear rationale, as the slide shows. Use briefings, dashboards, and action plans, and assign documented follow-up and ownership for each topic. Kathleen Lewis is an expert in standardized risk databases. According to Lewis and colleagues, centralized records improve auditability and support cross-site comparisons. Combine these records with trend signals from large-scale studies, but use local judgment. Clear communication links analysis to site action and completes the cycle of supervision of health, safety, and welfare. This slide talks about intervening promptly to stop unsafe actions and documenting corrections. Stop the work, coach the operative, then record the incident and corrective action, as the slide example shows. Sally Moyse is a public health researcher focused on migrant worker safety, and her work highlights communication barriers. According to Moyse and Schenker, supervisors must use translated coaching and verified competence checks. Keep a clear corrective action log and follow disciplinary procedures to show duty of care, which leads into ensuring workers understand their legal responsibilities. As you can see in the slides, explain statutory duties and site rules clearly, then verify comprehension through briefings and simple checks. Review role descriptions and obligations with each operative, and use short quizzes during toolbox talks to confirm understanding, matching the slide examples. Kathleen Lewis is an expert in standardized risk databases, and her work supports keeping clear role and training records. According to Lewis et al., use templates and sign-offs. Clear confirmation of understanding prepares teams to use PPE correctly. Supply appropriate PPE for assessed risks and train operatives in correct fit, inspection, maintenance and replacement. As the slide sets out, check fit and wear compliance on arrival and during shifts, and log PPE issues and resolutions in a central register, matching the slide examples. Scott Lundberg is a researcher on model interpretability, and his work shows explainable diagnostics increase operator confidence. According to Lundberg and Lee, make PPE checks understandable. Reliable PPE provision links directly to implementing workplace controls and employer duties. Implement controls following the hierarchy of risk. Coordinate resources, training and workplace adaptations as shown on the slide. Arrange engineering fixes and signage, and schedule welfare facilities and inspections using risk assessment outcomes. Mohammed Farouzanfar leads global burden of disease teams, and their work highlights using trend analysis to set priorities. According to Farouzanfar, use local data to guide which engineering or administrative measures come first. Clear records of controls and inspections make audit cooperation smoother and support regulatory compliance and meet HSE expectations. Provide records and support audit processes by producing logs, photos, and permits, as the slide details. Liaise promptly with inspectors and regulators and act on findings to implement improvements and close actions. Kathleen Lewis is an expert in standardized risk databases, and her work supports centralized, auditable records. According to Lewis et al., keep authenticated copies. Triangulate audit findings with local incident and near-miss data, as suggested by global burden of disease approaches, to demonstrate supervisory duty and enable effective supervision of health, safety, and welfare. Supervising site health, safety, and welfare demands integrating competence, robust maintenance, secure record keeping, data-led improvement, and statutory duties under the Health and Safety at Work Act, ensuring operatives are competent with regular monitoring and maintenance of plant and tools, PUWER/LOLER, reduces risk. Accurate, secure records support traceability and compliance. Analyze safety data, identifies trends to inform improvements. Supervisory duties anchor actions to HSE expectations and legal duties. Together, these elements meet the learning objective to supervise health, safety, and welfare, bridging theory and UK practice. All sources and references can be found below the video, and if they have any questions or need guidance, they should make use of the Live AI tutor for one-to-one mentoring and support. Consider how these strands shape safer sites and inform future study.